Adolescents and young adults are really important in of themselves, so it's really important for young people to have good experiences during that time. But they're also really important contributors to how we operate as a society. They come up with lots of good ideas about how things should happen. I think adolescent transition care is vitally important to get that right, so that young people are supported through that time and young people can get on with the things that they actually want to do. The Statewide Adolescent Transition Care Clinical Network is formed of a broad group of clinicians and researchers who've come together because they're invested in improving healthcare outcomes for young people. There was a really strong interest when the network was formed from lots of different sectors, and I think that's a reflection of how we as a community value young people. So one of the major achievements of our clinical network is that our meetings are very enjoyable, and so we get lots of enthusiastic participation from the people that attend our meetings. And what that has led to is a culture within the network of valuing people's opinions, ensuring equal contribution, and really being thoughtful about how we come together and how that informs what we do. We've set out our value statement about how we feel that healthcare should be delivered for young people, and moving forward we're looking into a statewide strategic framework for adolescent transition care across the state, as well as broad youth representation for that framework and for informing health services. So the other piece of work that the Adolescent Transition Care Clinical Network is looking at is how the data collected from systems informs what we do and how we deliver care. And it's really about how we link things together so that we can see the journey that young people take through healthcare systems. Along with that, we are exploring qualitative research methods to really get an in-depth look at how young people feel about the healthcare that's delivered to them and what ideas they have, because the best ideas about healthcare for young people is going to come from young people. The eventual outcome of the Adolescent Transition Care Clinical Network is that every adolescent in South Australia receives world-class care, regardless of who they are or where they live, and that they have control over how that care is delivered and input into where they get it and what it looks like.